I also want to thank you, Dr. Ahmed, for talking about that some of this is generated or at least linked to a history of sexual abuse, and seeing a clinician can really be a game changer, parsing that while you do PT, again, while you're seeing your village, while you're seeing your physiatrist and gyne, also doing that work to work through that trauma can be a really, really impactful thing in terms of painful sex and sex that might feel traumatic, sex avoidance, things like that. And I'm happy to go into that more, but I just wanted to thank Dr. Ahmed for bringing that up, because that's a big part of pelvic pain for both men and women.
So like we'll often refer patients if they have a history of trauma or PTSD, or if there is any OCD component, is there do they need a sex therapist? Do they need a somatic therapist? Are they not able to separate their mind and body? It's way more complex than like, do you have unwanted sexual contact? Because we kind of really have to delve into it and get them like that bucket. Who was saying buckets? That
Jason.
Saying that, if they need that bucket to be filled, they have to find someone that will make them feel safe and help them with that.
If I can say, sometimes this emotional connection is more nuanced. It's almost more helpful when there was a clear trauma that led to this injury and they can identify that. It's more difficult when there's another stressor in their life that they may not want to acknowledge is a source of pain for them. The pain sometimes can be a source of avoidance, the emotional stressor can actually be, I'm getting myself all twisted around here because it goes both ways, but they can use the pain as an excuse not to think about the emotional stressor. And then it can sort of reinforce it in that way too. So Dr. Wolkin, if you have a quick test, like what if I'm not acknowledging that there may be something that's contributing to my overall pain experience? Is there anything quick I can just ask myself to try and see if that might be an issue for me?
No, because I would be concerned that it's not an easy answer, because I would be concerned that one of the reasons, and make the case for the fact that one of the reasons it's not so clear cut is because you're cutting off, your conscious mind is cutting off from it, and there's a reason that you're protecting yourself from it. And so my recommendation would be find a safe space and start to unpack it. Slow and steady, ebbs and flows. Healing is so possible, and it can go a really long way. Again, I would advise not to, ask yourself those triggering questions necessarily, though
So if they are triggering, that might be a clue.
If they're triggering, that might be a clue. Yes. Yes. If you're having a hard time regulating after, if you're feeling overwhelmed, if you're going straight into panic, that might be a clue that there's something to explore.
And we see this a lot. I work at the VA. I see it with the vets there, and it's so distinct because there is a physical trauma. They may have lost the lives of some of their buddies, and they may have not been terribly injured, but that injury then becomes so burdensome because it's associated with that. I've had patients who were driving a car and they got in a car accident, and their passenger, who was their good friend, died. And they weren't tremendously injured in that car accident, but it's creating a lot of pain, and it's ongoing pain. And it's super challenging.
On that note, I also just want to quickly say that something I recently learned was that stress and emotions actually activate the same exact part of the brain as pain, which is the danger and alarm mechanism. So I think just knowing that and understanding what's happening when you have emotional triggers or emotional situations, knowing that if you get a bladder flare or a vulvodynia flare, pelvic floor flare, whatever it is, whatever you have, being able to understand that, was there something stressful that has happened in your life, whether it was 5 minutes ago or 5 days ago, that could account for why you are feeling symptoms. And I think just being able to, as a patient, as a human being, being able to understand the correlation and know that that actually is a real scientifically proven thing is really, really helpful in understanding your own pain.